welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Cindy Roark. She is a dentist and a healthcare executive, and her Kevin MD article, which we'll talk about today, is titled The Connection Between Oral Health and Overall Health. Cindy, welcome to the show.
Thank you, Kevin. I'll give you a little bit about my background. I am Senior Vice President and Chief Clinical Officer of Sage Dental, and we're primarily in Florida and Georgia, so southeastern United States at this point and growing. My background actually was clinical care for many, many years, and I probably never believed I would end up in an executive role, but that's what happens when you go through this field. And some fascinating things that I can share with you today, a little bit about the intersection between overall health and oral health.
Yeah, so before we get into that, we don't have very many dentists on the show. We don't get a lot of that dental perspective on the show. So in general, how is the healthcare landscape facing like dentists today? So what's your comments on that in general?
Well, I mean, it's very interesting. If you think about it in response to an overall look at medicine, dentistry, I think for many years has been a little bit behind, right? We weren't part of the HITECH Act. So that meant all the dentists in the country did not migrate to electronic health records at the same time. We didn't have funds available to move into digital x-rays at the same time. And so if you really look at it at this point, we're playing catch up, right? There are these amazing AI things out there that can be used, but when you have a group that did not have digital for many, many years, it takes some time for us to catch up. So I think for me, I look at it and I think everything we want to do, we want it to be scientific and reproducible. And until we start utilizing these tools, we're going to remain behind.
So in the next year or so, what would you say are some of the biggest trends that one would see walking into the dentist's office?
Oh, well, I'll tell you, in the dentist office, from a dentist perspective, you're going to see the penetration of AI to help annotate x-rays. And if you think about it from medicine, Kevin, every CT scan, every MRI, all those things are run through an AI engine of some sort, right? And we have the capability, the bandwidth technology's there. And so what I'm seeing right now is that really take off, because if you think about it, other areas of medicine, people typically aren't their own radiologist. You have radiology review, then you decide what you're going to do, and dentists have to do that dual role. So I love seeing technology that can kind of outsource, and what you decide to do is certainly up to you, but you need to have a single version of truth. Like, what is decay? What is an open margin? You have to have that one version of the truth. So I see AI really penetrating not only the dental schools, but dental practices pretty rapidly, because I think what we owe patients is that consistency. We don't want them going to 10 dentists and getting 10 different treatment plans. That's not reproducible.
All right. So now let's talk about your Kevin MD article. It explores that intersection between oral health and overall health. Now, for those who didn't get a chance to read your article, just walk my audience through it, share the story, why you decided to write it.
Sure. I wrote it because I think quite often we're in silos, right? And people will think, oh, dentistry is important. You've got to brush your teeth, but you don't really think about, guess what? Your mouth, my mouth. Number one, they're the dirtiest places in the human body, and they're attached to everything else. It's attached to the rest of the body. So that would indicate to you that if things are bleeding or wrong in the mouth, that your body has access to your bloodstream, and people don't often think about that. Like, quite often I'll have a patient who will, think their teeth only bleed because we used a probe on them. And if I can touch your skin anywhere, whether it's gingiva or your arm, if I touched it and it bled, there's a problem. But people don't really look at the mouth that way. And I think you're really seeing an evolution right now. And one of the things I think that brought it to the forefront, Kevin, would be COVID. Right? Dentistry was shut down, just like medicine was shut down. And so it gave us time to really look at data, look at enhanced studies and all these things. And what we found out as we went through that pandemic would be that if you have periodontitis, you're actually 3.5 times more likely to be admitted to the hospital, 4.5 times more likely to need a ventilator, and 9 times more likely to die.
Wow.
Why is that? It's inflammation. It's just like everything else in medicine. It all ties back to inflammation. So those are the things I think people pay attention now more than they did in the past. That's just kind of a one-off example, but there are so many. It's like, if you think about it, The average human in the US might take several medications. And so, what does that mean, right? If I'm taking an antihistamine, diuretic, painkiller, antidepressants, many people take those, decongestants, they decrease saliva. Well, what does saliva do? It's protective for your mouth. So it means if these medications are turning off your protection, you're probably likely to get more decay. You're probably likely to move into gum disease category. And then you start that whole inflammation cascade. So there are things that if you get out in front, if you know, and you get out in front of it and you use something as simple as a saliva replacement, when you're on these things, you can stop a whole lot of negative effects.
Now, tell us some of the common oral health or dental issues that may arise in a primary care office like the one I practice in.
Sure. I think elevated A1C levels, you see the diabetic type 2 diabetes is really epidemic at this point. And that one for us is actually cyclical. If MDs did nothing else but high A1C said you need to see your dentist, that alone would be helpful, because what happens with A1C is it increases the inflammation levels. So it's a cyclical thing with that particular one. Number one, poor sugar control is going to increase that inflammation, and increased inflammation continues to affect your sugar control. So something as simple as diabetes that quite often is dealt with in a regular medical care office, they need to be going to the dentist. It'll help you, and it'll help us, and it'll help the patient, right? But you need to be doing it. I just don't think that's on people's radar by and large.
So if I'm in the exam room and I'm doing, say, a typical physical with a patient, tell me what kind of questions I should be asking that patient that may uncover an underlying dental issue that I need to be worried about and say, hey, you need to see your dentist about.
Well, very simple. Anytime you've got blood work, you're going to see the A1C levels. So anytime
Okay.
you're concerned about diabetes, definitely want to get them into our hands. It's that simple. You don't even have to look in the mouth. We know there's going to be an issue there. We know control is going to be an issue, and we know they're going to have inflammation. And here's what's interesting. Everything's related, Kevin. And if you think about it, there's all this inflammation related to diabetes. And then what happens when you suddenly have a situation where you allow kind of the oral bacteria to take over, right? P. gingivalis is the most common culprit in periodontal disease. And if people aren't aware, if you're in a different piece of medicine, periodontal disease then starts eating away the bone that holds the teeth in, right? So now you've got something taking that bone away. It's not coming back. P. gingivalis is actually the number one bacteria isolated in beta amyloid plaques in Alzheimer's. So I'm not standing here today saying that, periodontal disease causes Alzheimer's. I'm saying it makes it worse. So if you've got a situation where you've got a patient, possible dementia, possibly heading down that path, absolutely those people need to be in their dentist's office right then, right now, on a different regimen, because we know it's going to make it worse. It will just continue to get worse.
Now, whenever I think about oral health, there is a traditional connection with that and endocarditis. So tell us what the current thinking about that connection is.
So the current thinking on that, we used to pre-medicate everyone who had ever had rheumatic fever, any of these things. And so I think Dentistry and the Dental Association, American Heart Association also have gone back and forth about whether they feel like we're giving too many antibiotics, thus giving resistance, or whether we're actually helping. That I wouldn't comment on. What I would say is with endocarditis, that inflamed heart lining, anytime I have the ability in your mouth to provoke blood, right? It now has, again, access to your circulatory system. And what happens? It gets lodged on stroke and heart attack plaques that are forming. So again, it's not causing those things, it's making them worse. So if we know that we can do something to keep things from getting worse, then we probably should. And so, I kind of joke, and I just think it's really an education and referral thing. And we typically are in such silos with medicine and dentistry that I think it isn't topical. People don't think about, oh my gosh, this person's got Alzheimer's, or they've got diabetes. I need to get them into their dentist's office. People don't really think about that. Or they have a history of endocarditis. Definitely need to get them into the dental office. It just isn't topical. They don't think about it.
Now, one of the things that you mentioned when I was reading your article that I really didn't make that connection with was when I prescribe a lot of medications, certainly has effect on the saliva production. So go into more detail in terms of what I can do to help prevent some of the dental complications of that. Is it as simple as just going over the counter and getting some type of moisturizer? So give us more detail in terms of what we could recommend to our patients when we prescribe a lot of these common medications.
Right. Any of them. I mean, again, I think probably the ones I see the most of would be antidepressants, just everywhere, and rightly so. It's been a tough time for a lot of people. But
Mhm.
anyway, diuretics on the cardiology side, they're heavily prescribed. And so something as simple as telling them when they go on to it, just grab some biotin at CVS or Walgreens. Very simple. It's $3, not expensive. And again, if you're rinsing with that every day, you're protecting yourself, and it's that simple. It's not even hard. But quite often I'll see somebody who's reached a certain point in their life and they're like, this is crazy. I've been to the dentist, twice a year for 30 years, and now all of a sudden I have these things. What's going on? And my reaction is typically, well, what new medications are you on? How long have you been on them? And let's go from there. So I think obviously we know in medicine, prevention is key. We'd like
Mhm.
to prevent it versus deal with it after, because I can't regrow bone today, at least not well enough to do it, on every patient that has perio. But for me, just having the knowledge base as a doctor to say, hey, I see you're going through a tough time, Mrs. Jones. I'm going to put you on sertraline. You may want to pick up a bottle at CVS because it'll really help keep, protect your teeth.
We're talking to Cindy Roark. She's a dentist and healthcare executive, and her Kevin MD article is titled The Connection Between Oral Health and Overall Health. Cindy, we have a platform here primarily of medical clinicians. So are there any misconceptions or misperceptions about the dental profession that you would like to clear up?
Probably just this big connection. Everything's interrelated. I can remember back in dental school, it was interesting because the school that I went to, the dentists and the doctors took a few classes together, and then we sort of separated as we move into the clinical phases. And I can definitely remember hearing somebody say, like, gingivitis, periodontitis, like, how hard can it be? Right? It's not even medicine. And I would just say that if we have the ability to make things worse, and these are the big ones, right? Diabetes and Alzheimer's. And there's even a link to ED, which is always interesting to me, because I'll have lots of times, not to stereotype, but I'll have a male in the chair, and I might get something where they're just not really interested in hearing where it's heading. And then I say there's also a link with ED, and they're suddenly listening. Right. So I think for me, the misconception I see is that they're not interrelated. Clearly they are. It's the intake, it's the first step into the body. Yourself, because you read these things. If you have an abscess in one of your upper teeth, it can travel to the brain. So again, is it life and death every minute? No, it isn't. But definitely, if we have the ability to bend the curve, make some of these chronic diseases a little less virulent for people, then we probably should be doing that. That's what I would clear up.
And my final question, any take-home messages that you want to leave with the Kevin MD audience?
Definitely just do your homework. Realize that you can do things outside of your own primary care system that will very much help. For instance, you've got patients that have a type of cancer. They may be undergoing radiation therapy or chemotherapy. Both of those, depending on location, have the ability to really affect the parotid gland and the saliva. So again, it's absolutely critical that they see a dentist before they start either of those two things. So I think that's probably the biggie. We want to keep people healthy, and then you want to keep those that are not exactly healthy from getting worse.
Cindy, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin. Appreciate it.